And welcome everyone to this week's Maternity and Midwifery Hour. My name's Sue MacDonald. I'm the curator for the Maternity and Midwifery Festivals and the Maternity and Midwifery Hour. And it's my pleasure to be chairing this evening's session, which is week 9 of the 15th series of Maternity and Midwifery Hour. And I'm delighted. I'm joined by two luminary midwives. I love this. I have Dr. Jacqui Williams and Tracey MacCormack. And here they are. Welcome, both of you. Now, because we always do this with our
Thank
guests,
you, Tracey.
we ask them to share a moment of the week with us. And it can be anything and everything. And shall I start with Tracey? Tracey looks as though she's had a good think about this. Welcome, Tracey.
Thanks for having me, Sue. Yes, I have had a good think. This has been a good week because we did say yes to the dress for my daughter-in-law on Saturday. So, yes. So, yeah, that was the highlight. She didn't say yes to any dresses, but we at least had a fun time looking at different ones and thinking about what we were doing. So that was really exciting.
Oh, fabulous. And is it true they give you a glass of bubbly while you're looking?
Yes,
I like
definitely.
that.
I like that. That was the highlight, actually. It was quite nice.
Wonderful, Tracey. And I mean, now, once you start looking at the dresses, there's going to be dresses for your good self, of course.
Yes.
Yes.
Yes. Yeah, I've started looking as well. So.
Fabulous. Thank you so much for sharing. That's a lovely one. Thank you for sharing that. How about Jacqui? Do you have an equally delicious moment of the week?
Yes, quite different, I think, for me. But I live in Lincolnshire and the daffodils are finally opening. A little bit late, I think, actually. And although we've got this chilly weather, they are beginning to come out. And what that means is that my daughter is returning from deployment because we've been waiting since January. She's been on deployment. So now that it's March and the daffodils, she's coming home on Saturday.
Oh, how wonderful. I think that's cheating. That's
Is
two
that a
good
cheat?
moments. 2 moments.
Oh, 2 moments.
Daffodils and daughters coming back. How lovely. That is fantastic. It is very cold. I'm sure our audience will have noticed it's a bit cold where they are. We certainly have. And there's something about those golden daffodils now coming up that really gladdens your heart. So thank you so much for sharing the 2 moments of the week. Now we're going to just do the usual little bits and pieces before we unleash our speakers on you. And I'm just going, and I think because this is very much on my mind, because you'll know, those of you who are with us as regulars will know this. Those of you who are new, welcome, and we're glad to have you. These maternity and midwifery hours started 5 years ago, right at the beginning of the COVID lockdown. And we kind of came up with it because we knew midwives and student midwives and the people who were in maternity care services couldn't access study days, conferences, or anything like that. They were really busy in the clinical area. It was a really stressful, scary time. And a lot of you who are watching now will have memories of that. And I certainly did, because a few days ago we had the sort of the reflection day on COVID-19. So it's very much on my mind. And we've carried on. And initially we had a lot of focus on COVID-19 because it was new and services were having to change, and education particularly, which is kind of what we're going to be looking at this evening, was particularly hit. And there was a lot of very creative work and a lot of work from our regulators who are with us to make sure that students' learning and development and their route to become midwives was protected at the same time as protecting them, and ensuring maternity care was provided for women and babies. So it was a scary time, and I'm just very, very remembrant of that because we're 5 years old now doing this maternity hour. Also, for those of you who are new, you might not realise everything we do on the Maternity and Midwifery Forum is recorded, and you can access it afterwards through Matflix, and that is on your resources sheet, accessible on from Paul is going to make that accessible to you. And also you can, for a smallish subscription, you can join that and access all of the stuff that's done on Maternity and Midwifery Forum, on the hours and on the festivals. I think the health warning I would give is once you get into it, you can't get away very quickly because it's so interesting. You'll find lots and lots of really good stuff. Really good if you're doing revalidation. Really good if you're doing a project or dissertation because there's so much there. But I know to my cost, because I'm very easily distracted on these things, you can start off looking at something and then something else will come up and you think, oh, that is interesting. Let me just go along and listen to that one. So that's my health warning for this evening. Now, I want to say also a big thank you to midwives, student midwives, all the people who are supporting maternity services. You are fabulous and keep on doing what you're doing. And I can't reiterate that more. Now, I have the news feature. Okay, we had the COVID-19 Day of Reflection 4 days ago on the 9th of March. It's still National Women's History Month. That's the international one. And in the resources, there are links to some really interesting sites. And I think it's really important. And I know I kind of always think midwifery is a very woman-dominated profession. And I think we need to celebrate the women that are around us, the women behind us that have given us what we have now. And it's not been an easy route, as you'll know, if you're focused on history, you'll know that. It was also International Women's Day at the weekend, International Day of Women's Judges also. We're also still in the month of Ramadan, and this is, for those of you who will know better than I, the time of fasting, prayer, and more importantly, reflection and community. Very important time. It seems to be a very busy month this March. We've got National Nutrition Month. We've got Endometriosis Awareness Month. And there's I think there was Brain Awareness Month as well. I kind of ran out of space for this one. Also, I want to draw your attention. There's a really good article on the Maternity and Midwifery Forum newsletter, which is by our Gene Affinity, with a spotlight on burnout. I don't want to be negative, but we need to be aware of burnout and try and prevent it in ourselves and others and support each other. And I noticed this was a really good article with some super resources, which you will find really useful. I'm speaking very quickly because I want to get onto the main meat of the evening, which is midwifery education. What next? And we've got our two wonderful speakers this evening, and we're going to start. And I mean, I need to just focus. These are national regulators for the Nursing and Midwifery Council. I say that for the people who are from other countries, so you know who Tracey and Jacqui are, because we know them very well. And just to say, the ways midwives are trained and supported and prepared for the future is evolving, and it's always evolving. It never stays the same because it can't, because society is changing, knowledge is changing. We need to make sure our students and our existing midwives are really prepared and supported to stay up to date and be prepared for practice. So we're going to be talking about the work of the Nursing and Midwifery Council and the midwifery team in particular, because obviously the Nursing and Midwifery Council includes the nursing side as well. And we're also going to be looking at the practice learning review, which I'm going to be very interested in. And I need to remind you that the speakers' CVs are fully online. I'm just doing kind of edited highlights because obviously our speakers are always very experienced and have quite big CVs and big important, and you need to know who they are. So I'm going to start by introducing Tracey MacCormack. Have I said that correctly, Tracey? I'm looking at it. It doesn't look right. It's in my brain somehow. Who is a very experienced midwife. She's had experience of providing care to vulnerable and hard-to-reach women with substance misuse. She's been a maternity improvement advisor with the NHS England. She's been a director of midwifery and gynecology. She's been a Freedom to Speak Up ambassador and now is assistant director for midwifery at the Nursing and Midwifery Council, which she started her role a year ago now. So that's it. She's got a master's in advanced practice and leadership from King's College and the Nye Bevan Executive Healthcare Leadership Award from the NHS Leadership Academy. She's also, and you've got the hint of that, a mum of 3 and a grandmother of 2. So I'm going to say a big welcome, Tracey. Thank you so much for coming this evening. And the screen is now yours.
Thank you, Sue. So I'm going to start off our discussion just giving a little bit of a background about our team, about what we do and regulation in the Nursing and Midwifery Council, and then some of the highlights of the work streams that we're working on, then hand over to Jacqui to have a discussion with you. So we are a team of 3. As Sue said, I started with the team last March, so exactly a year ago now. Jacqui has been with the team since 2018 and Verena 2019. We're quite an experienced team, and our experience covers midwifery in the hospital and community, including midwifery-led units, home births, free births. We've got quite a lot of management and leadership experience, governance, quality assurance experience, very experienced education in policy, confidential inquiries, expert witness work, statutory and clinical supervision, and system regulation. So we use all of our midwifery experience in the work we do within the organisation. So Jacqui's role is Senior Midwifery Advisor, and in brackets education. Verena is in brackets policy, Senior Midwifery Advisor, and I'm the Assistant Director, but we work together as a team and just make sure that we cover everything across the NMC that is to do with midwifery. So one thing that I just wanted to mention and talk about is midwifery in the NMC. So it's the Nursing and Midwifery Council, and what our role is to amplify the voice of midwifery within the NMC, but also make sure that everything that is done within the NMC has midwifery identified and midwifery heard as well. Now, there are 45,198 midwives currently on the register, which works out as about 5.37% of the overall NMC register. It does sound like it's a small percentage, but we always sort of focus on the fact that midwifery is a profession in its own right and focus on making sure we keep it central. That is what our role is, and that is what we do in everything we do. So we are working on quite a few work streams at the moment to make sure that we keep midwifery central. So as you will know, and today is one of those examples, we do a lot of engagement with midwives across the UK in speaking engagements. We do a lot of training sessions, a lot of webinars, conferences, festivals to discuss our standards and support implementation and just really show what the NMC is doing for midwives across the UK. We do a lot of collaboration with key stakeholders on different projects. One that we're working on at the moment and that we will be bringing out quite soon is a collaboration with key national stakeholders, including NHS chief midwifery officers. We're working with the police, we're working with Doula UK, birthrights, just to name a few. So a lot of UK stakeholders to look at personalised care principles for women. And this work is based on the reported increase in requests for free birth and care by unregulated people. And we did find that it was a very important piece of work for us to be involved in, because we have the UK perspective, but also we have the Articles 44, which is the protected title of a midwife, that it is illegal for somebody to call themselves a midwife, and also Article 45, looking at the function of midwifery. And because of that, we did feel that we wanted to be part of this piece of work. So we are in the process of looking at drafts of this piece of work. We've had a lot of collaboration and focus groups and task and finish groups over the summer to create principles that look at what this means for women, what it means for midwives and the wider maternity team, and what it means for organisations, and how we as a collaborative can support having sort of clear messages in the form of principles for everybody. One of the things that kind of fell out of this discussion was the fact that there was no data around this. So we are in the process of collecting, analysing the data that we collected just towards the end of the year, from 146 units across the country, to find out what the impact in the rise of free birth requests has been for trust and health boards. And this information will be analysed and sort of published alongside the principles that we hope to have sort of in early spring. So that is a really big piece of work that really will sort of support midwives and support the wider maternity team. We're going to be participating in the upcoming review of code and revalidation, and we will be coming out next year to speak to people about what this means for them and get people involved in that. And also we'll be looking as part of this what that means for advanced midwifery practice in terms of how people revalidate there as well. Jacqui will be talking about participating in the ongoing work with the practice learning review, so I won't talk about much about that. That will be something that you'll talk about a bit more. And we're also looking into medicines management and into our midwifery exemptions. Verena is leading a lot of work around that. We're supporting midwifery education through the quality assurance processes. We're considering EU directives in our work. And we, if everything we're doing in the NMC, this isn't just midwifery specific, we're looking at the use of AI and technologies in how we sort of enhance our work and things, but it's not a midwifery specific thing. And we're supporting a public midwifery campaign. We're at the early stages of this at the moment. And this has come about, and we actually had our Midwifery Strategic Advisory group yesterday, and it was something that was discussed about celebrating midwifery. How do we celebrate midwifery? How do we bring out the good things about midwifery? So we're looking at how we can have a campaign that actually gets us to support that again and get people to understand how amazing it is to be a midwife, really, and what it means to work as a midwife. And another thing that we're doing, which is alongside that, there are a lot of national reviews and inquiries at the moment, and we are giving a midwifery voice to the work that's going on there. So in a nutshell, really, well, quite a big nutshell, we're championing midwifery regulation and across the NMC in all the work streams that we can influence within the Nursing and Midwifery Council. Thank you.
Fabulous. Gosh, there's a lot of work.
Yes.
You make it sound very straightforward, and I mean it's not a huge team doing all of those things, and there's a lot of complexity, especially around the sort of work about the EU, because for years and years, and I say this as a midwife teacher, we've always felt that those EU midwives directors are so precious, and it's that's one of the things that's quite tricky to think of not having. But yes, you need to, because we need to be able to work together, especially in these times. And I love the sound of the celebration of midwifery, because as you said, and I think it's worth people thinking about this, because there have been several reports and many have been quite critical of midwifery and maternity care. And we need to acknowledge where we haven't got things right, and we need to improve things like communication with women and families. But also it kind of leaves midwives and student midwives, and we were talking about this a bit earlier before we came on to speak to everybody here, about feeling proud to be a midwife and being in a profession that is providing something special. And I think you did mention in your CV, Tracey, being very proud of being a midwife, and that really comes over beautifully. And I think I'd like our audience to just hold on to that, because it is so important, because it's easy, especially when we're stressed and the work is hard and we're busy, to sometimes forget why we came into midwifery and that joy that you get of providing care. And that's not just catching babies. Again, we were talking about that a bit earlier, but it's about the provision of real special care to women and their families and their babies. So thank you, Tracey, for getting us started. And I'm going to have to move on now to Jacqui. And I'm delighted. I mean, Jacqui Williams, Dr. Jacqui Williams is an old friend of ours, and she's been on the maternity hour a few times, and she's very welcome. It's lovely to see you. Very experienced midwife, midwifery academic and practicing midwife with over 30 years involvement in pre and post-reg midwifery programs. She's a senior fellow with the Higher Education Academy. She's got particular area of expertise in quality assurance. Her doctoral work researched resilience and its development in student midwives as they navigate the undergraduate midwifery programme. She's also a fellow of the Royal College of Midwives, and her current role as Senior Midwifery Advisor at the brackets education is very much about supporting the development of the new education standards and the wider work of the midwifery matters across the NMC. So thank you so much for coming, Jacqui. Welcome.
Thank you.
Forward to hearing about, mostly about the NMC review of practice learning, and why is the NMC doing this? It's always been, mind you, I don't know, I'm asking in a way because it's always so easy. I'm always so busy, I'm sorry, developing new areas of work and well, let's start with that though. Tell me about this NMC review of practice learning.
Well, would you believe that the standards of proficiency for midwives and the original standards for pre-registration midwifery programs are now coming up to being sort of 6 years old? When it was November 2019. So and we did a review when we left the EU, and we didn't have to align with the EU directives anymore. So in fact, the standards of pre-registration midwifery programs were refreshed in 2023. Now, it was interesting at that time that nursing sort of slightly diverged. I mean, our standards are quite different between nursing and midwifery, and I think that's really important to acknowledge, that when we look at standards, we do have that alignment with our nursing colleagues, but sometimes we do need to differ. So the standards of proficiency are quite different, as are the programme standards. And our nursing colleagues post-COVID did introduce some elements which midwifery didn't want to go down. So, for example, replacing some practice hours face-to-face with simulation. So that was simulation for practice learning. And they actually had an amount of hours that they could use should the universities wish to do so. But midwifery were fairly cautious at that time, and it was very much based on the lack of evidence. And I'm still sitting here thinking that we still haven't got the evidence. We've got really high quality standards of proficiency for midwife based on international and national evidence, but the evidence within the programme standards, which underpin how a student midwife joins our register, there is very little evidence. So what we did in 2023 is really the standards exceed the EU directive, but they very much align. So the sort of things I'm talking about are when you're thinking about the number of times you have to practice a skill, such as the antenatal examinations, postnatal examinations, number of births. But at that time, and I'm sorry for the very long answer, because I need to give you a little bit of history, Sue, is that we were challenged by certain quarters that we hadn't been ambitious enough for midwifery. So we did some work last year where we looked at, we had a National Trust, Florence Nightingale Foundation, did this piece of work for us over a 6-month period, re-looking at the evidence. And I think there was no doubt there were things that were emerging that midwifery really needed to look at in more detail, but we're still lacking in evidence. There's been no further evidence for that. But we do need to do something. We need to really think about maybe the direction of travel. So we're just about to embark on this second part of this work. And council actually approved that we would have those 5 key learning lines of inquiry, and obviously midwifery is included in that. So that's really where we are at the moment, and that little bit of plotted history to explain why we're doing this.
No, it's very interesting because And I always have this by my side. And those of you who haven't got a copy of this, it is available online. And this is the proficiencies, which is very in-depth, and it's based on the Lancet study
Yes.
that was done and very evidence-based. And I'm
Yeah.
sort of always
And we're not looking at the standards of proficiency at the moment. I think we need
but
to
it's
make
kind of
that clear.
that's kind of people are familiar with that, and it's
Yeah.
kind of, it drives the way we are teaching and learning, I guess, doesn't it? Because this is relevant for midwives as well as students, because we should all be able to achieve those things.
Yeah.
Just so what are you going to look at? Because if there's a lack of evidence, which I mean, a lot of it is like I think we were talking before in the past about the 40 deliveries. I know this is one of the things that students have a problem with, and that's not necessarily evidence-based, except it worked in the past. I guess everyone had a particular standard. So what are you going to be actually looking at in this review?
Well, these key lines of inquiry have really come out from what Nuffield Trust found in their work, because they conducted a literature review, which obviously was sort of lacking still, but they did a lot of focus groups. They spoke to a lot of students, practice supervisors, whole range of midwives. And there were some concerning things that actually they shared with us. And I think what we recognise is that for some students, practice learning is not a positive experience. And unfortunately, it tends to be what we found during that research, particularly, it tended to be the students who had protected characteristics and those requiring reasonable adjustments, that ones that were found to be challenged more. So we need to look at that. We need to look at those learning experiences of those cohorts particularly. And because we know that if they are not positive, it affects their learning, their ability to achieve their proficiencies, and it impacts on retention. Now, this is going to be across nursing and midwifery. And I think that's important to say, that there's those commonalities. It wasn't just within nursing or midwifery that these were, it was right across all the student cohorts. And I think we recognise as well, because we were hearing this from people's experiences, that we need to look again at the type of support that is offered to students through practice supervisors and practice officers. So this could mean that we not change standards per se, and we don't know what we're doing yet. So I don't want people to think that we're making changes, but it could be that we strengthen as opposed to replace or change or add. This is why it's so important to do these in-depth work in these particular areas. And of course, for nursing, who've got nursing associates, they have protected learning time, which is a specific thing. So this whole issue about being a student and not counted in the numbers, and for some actually having that protected learning time is important. So that's the other area we want to look at. And then when we come to midwifery, nursing will have something similar. We actually want to evaluate aspects of the midwifery curriculum. So whilst the ability to achieve things like births will be included, that is not the total focus.
No.
Because if you remember, Sue, the number of proficiencies within those, what they have to achieve is huge. And I know from personal experience, midwifery students will be working in practice, will be in practice, working towards those proficiencies way into that third year, right up to the wire. Our nursing colleagues tend to be slightly different in that regard, but even at the time, midwifery educators knew that it was very packed. And of course, I'm sure aspects of length of programme will sort of come, which was a very much unresolved issue at the time. So yes, you know, births might be something that we will be sort of looking at, but I think the message I want to get over is we need to do a wider evaluation because there's all of these other sort of elements. And then, as Tracey mentioned, that we want to strengthen some indicators and metrics around our educational quality assurance. So there's definitely sort of some work to do, which in a way perhaps your audience may not be quite familiar with, because these are things that assure midwifery programs and working with the universities. But that's an important strand of work as well to do. So it's important that people sort of are aware of this sort of very holistic view, although we're actually only, you know, it feels like we're sort of honing, but practice learning is very complex in terms of all the elements of it.
Well, I'm thinking it is very complex because this is a huge project. How long is it going to go on for?
About a year. And again, we haven't got exact timeframes at the moment. We've still got things to do behind the scenes to sort of, you know, start beginning to do the work. We're going to have to do a public consultation. We aim that if there are any changes, and I think that there is an if here, because I'm not saying where we're going at all on this, that will become in place for September 2026. But that all depends, everything in place. So I don't think we want to drag this on, as it were. We want to do that in that defined period, but we have got certain processes that we have to do. And of course, that public consultation is that is part of our regulatory function, and we have to do that. And I would think that we would want to do it for the full length of time. And of course, that's public. And if you remember, we got over 1,000 responses from the public when we went to consultation back in 2019. So we absolutely need all the voices who from people who use maternity services, as well as obviously people that work within it, and obviously students as well. So that's the sort of time frame. But we're very much at the start of this. We don't know how we're going to do it, but in terms of we don't, you know, we haven't got an absolute plan in place yet. We know that from how we've done things previously, that it's really important to get the right people, people consulted, wide engagement. But how and the sort of time frame for that's still to be determined.
Very multi-layered, actually, isn't it?
Yeah. But I think what I wanted, as you know, to do this evening is really raise awareness amongst midwives, because I think this is going to be very impactful. I think we've got some really hard decisions to make, because whatever we do will affect midwifery education long into the future. And we need to sort of get it right based on not having the evidence.
Yeah.
And that's a challenge.
But do you think, because the evidence has been a huge thing, do you think this is really off the wall, but do you think this might lead to some kind of research kind of themes being put out for future after the
it would be excellent. It would be excellent that was done. I know I have heard of various quarters of people who want to do work in this area, because of course that in itself takes time, doesn't it?
Yeah.
But that's really what we need. And I think the other thing which is we've got to have our sight on is also what's happening in the EU, because although we're not obliged to be aligned to them, but they are our colleagues, and of course a lot of midwives around the world also look to those directives, and we need to sort of think about what's going on there too, to make sure that we're not just for people who want to go and work abroad or come to work here, but more just to sort of that cohesive midwifery voice, I would say, rather than maybe thinking we're doing something that would put us out out of alignment in a way.
We're seeing as, I guess, as our midwifery family in the world, isn't it?
Exactly.
And I guess in the kind of bonus from that is that women and families would be much more understanding if the services and the kind of education is and the skills of midwives are similar in different countries. Women coming over here or wherever they are going to be more familiar with what the services are. I'm just thinking out the box here.
Yeah, but I think as well, Sue, I think we've got to think about, women's perception. We touched on it a little bit earlier, didn't we? And, whilst we don't have the evidence for some of these things, we also have got to be very mindful of public perception, that whatever we do is not diluting or, our primary role is protection of the public. So for midwifery, that's safety of women and families and newborn babies. But, we've got to be, we wouldn't want to do anything that actually made those perceptions even more challenging, I would say. And that's why it's so important that the public will have a voice along the journey that we go as we do this work, but also in that final, in that public consultation.
So is the public consultation going to be at the same time as engaging midwives? And do you want to engage student midwives and people who want to become student midwives?
Well, when we start this work, there will be a whole series of ways that we will engage. We will set up potentially, more formal groups that will work on this, that will feed into a steering group that is already in place. Then we will go out to a whole range of engagement events, whether that be online or face-to-face. We will look to, get the message out there as widely as possible as we start developing the work. But then, of course, that engagement continues while a public consultation goes on, so that people feel informed about what they're being asked, and consulted on. And then, of course, having done all of that, depending on what we need to do with the standards, then, of course, there needs to be a whole implementation phase so that people understand if there are differences or where things have strengthened. So, yes, it's a lengthy piece of work, but that collaboration and gaining that consensus as we go along is absolutely paramount. And there will be differences of opinion in this, and we've got to sort of, navigate all of that.
And in a way, that's the positive thing, though, isn't it? Because you get a bit. I seem to remember when this, before this was designed, it was the Future Midwife, wasn't it? The whole
that was the sort of project, the project titled, and we did have a very defined project methodology, if you like, which we'll probably use again of how we do this. But it's actually, we haven't really firmed up timeframes and that sort of thing. We're at the start of that.
And I would have to share, as I was involved in some of the meetings and engagement events, I have to say it was very exciting. So anybody who's out there thinking, oh, not another review, it actually was really interesting, and you kind of got more of an understanding of all the different issues that impact into education practice. So it's an exciting thing to be involved in. And there is, if you need more information, I know Jacqui's provided a little link which should be on your resources. So after this hour, you or maybe tomorrow, first thing, you might want to go and have a look, because that gives you even more information. And presumably there's going to be a whole web page that's going to be available, lots of information, is it?
The link I gave this evening just talks about those key lines of inquiry and that decision that Council made in January. But just further down the bottom of that page will be a community of interest. Do sign up to that, because then you'll get updates as we go on, opportunities to potentially engage face-to-face. We'll be looking for that whole range of people who've got an interest in this. And of course, the challenge of all of this is all going on at the same time as, looking at the code. We've got revalidation. and it's how we actually, because there's a lot of overlap with it all, but actually we need to make sure that we get the wide range of stakeholders involved. So that's why the sequencing of all this is something to be really sorted out, particularly with the team of 3, as you said earlier.
Well, I was just thinking that. Now, last week, I have to show you this. Some people, our audience will recognise this lady.
Yeah.
Remember the knitting of the midwives years ago, where at one Royal College of Midwives conference, we decided it was to really raise awareness of the need for more midwives and someone said, oh, we ought to knit them. And so we knitted hundreds of these.
If I was at home, I'd be showing you mine.
Yes.
As we speak. I've got mine too.
Well, I'm afraid we need to knit some more NMC midwifery advisors, really, because when you describe, and when Tracey was describing what is going on, and I'm thinking, crikey, and now you're talking about AI, and how's that going? How are you going to? And I know this is across the nursing and midwifery, but of course, you, as a midwife, you will focus on your own area. That's the most important. Sorry. Has to be anyway. So I'm just thinking, so this is, you were saying about the outcome is probably going to be next autumn 2026.
For actually that it when we do anything with the standards, whatever we do, you do have to have a lead-in time.
Yeah,
so the universities need to know. So they will be given at some point some indication as to when things have to be adopted and implemented into their programs. But again, a lot will depend what happens. If we're talking about strengthening, or we're talking about new standards or replacement of standards, it totally depends. And this is why it is a little, we've got a plan at the moment and those time frames, but depending where we go with this, then there has to be some slippage to make sure we get it right. Because I think this, you've got to bring people on that journey, particularly if they haven't maybe thought of some of these issues, maybe in that sort of depth before.
And I think what's positive is that it's feeling very evolutionary rather than everything just being thrown in the air and we start again.
Yeah.
This is kind of looking at what we've got more with a it feels to me like a critical eye and getting women, families, other stakeholders, students, midwives, everyone being involved. Sorry, Jacqui, I cut you off a bit.
No, not at all. But I mean, I think, for student midwives at the moment, I think they need to realise this is probably for most not who are in current programmes going to affect them directly, but we need to hear their voice because they're going to actually input into things that are going to absolutely affect them as practice supervisors and practice assessors, and obviously midwives of the future. So their experiences is absolutely vital in all of this. And I think the other thing just to remember is that it isn't just, there is a whole team of people that actually support us in these endeavours. So absolutely we're in that space, but we work very closely with our policy colleagues, with our communication colleagues. These are people who are not midwives, but they bring that expertise. So we work in a multidisciplinary way within the NMC, as well as ensuring we get the right stakeholders and the right groups to input. And as you say, great opportunity for people if they do get asked, or they we ask for volunteers to come forward. And of course, the other thing I must mention, Sue, is that we have to think about it from a 4-country perspective.
Definitely.
Because, and that is also often a challenge, because if we think about that, we have Northern Ireland with an Ireland border and midwives moving between the two areas and on different regulators, that also has a sort of an implication to all of the work that we do, as well as, of course, equality, diversity, and etc. But But this is why we need a good range of people to help us in all this.
Definitely. I think so. Anyone who's watching, just be aware that you could be in that community. Now, what is it? Community of practice.
It's a community of interest.
Interest.
So there's a link for them to actually.
Fabulous.
We have a number of those at the moment for people who, if somebody's interested in advanced practice, we've got something similar. But this one particularly is for the practice learning review. And it means then that once you sign up to that, you get updates regularly, and then you'll be aware of, you know, whether there's events or other things that we're actually sort of doing. So it's important for those interested to, and that can be students as well as midwives. So anybody who's interested.
But it doesn't mean you have to go to events, but actually it's really good if you do. Yeah. So put your name down, because you can always opt in and opt out as you go. But the important thing is the voice is heard. The voice. You were
talking about obviously how we've worked differently since COVID, and I mean that is the best thing I think that's come out of it. By working in this way, we've got a much wider spread. I mean, the NMC traditionally used to sort of turn up at various events and people got invited, and those are important, and I'm sure we'll do some of those. But to do this in the online space, we can engage with midwives at all sort of stages of their career, and those of them who perhaps wouldn't have the opportunity to travel. And I think we want to hear from international midwives too. It'd be really fantastic to hear what they think about all of this and their experience.
Fab. Okay, well, I'll say thank you, Jacqui, for setting the scene now. So we've got some time for questions. I know there's already some questions. I need to just warn our audience that I look over here because I've got two screens, and my friend Paul is putting the questions through, so we can share them now with Tracey and Jacqui. So I'm going to start with now. We've got the first question was Laura. Hello, Laura. And Laura says, I'd like, if possible, to ask a question re midwifery education. As a return to practice midwife, we have been told by the university we have to do the NIPE for re-registration, but NMC state we don't need to do the NIPE to revalidate, as it's not a requirement. Any help or advice, support, please?
Yeah, really good question. Yes, I understand the question. So when we set the new standards of proficiency back in 2019, we included the systematic examination of the physical systematic examination of the newborn. We don't, in any of our standards, align to particular things that are going on at the time, because things change and we've got to have some longevity for the standards. But those standards, the little important bit in the proficiency say that they need to align to local or national guidance. And of course, we do have a slightly different approach in the 4 countries. But in England, the universities are now actually teaching to those NIPE standards, the newborn infant physical examination. So when somebody is returning to practice, that they actually align with that standard that the university is teaching to. So although our standards don't specifically say NIPE, it talks about local or national standards, but the universities do teach to that standard. Yes. So Laura, within your programme, you'll be following over the months almost the same proficiencies that the third years need to achieve, and that's what you'll achieve as part of your return to practice. So you'll be able to be a NIPE practitioner if you are in England, studying in England.
Yeah, I'm conscious that there are different terminology, and NIPE refers to specific bits.
England. Yeah.
Whereas I think increasingly people are using systematic examination newborn, which is the whole top to toe, which is a little bit, which incorporates NIPE.
Exactly.
I think sometimes midwives locally, Laura, use NIPE as a kind of shorthand.
Yeah. But I think what the other message to say is that these are a minimum standard, and the universities can exceed that standard in certain elements, so that even the universities might slightly differ in what they require. So it's really important when you're signing up for these programs to know what to expect from that university, because that's what they've been approved for. Yeah.
Okay, fabulous. Well, we're moving on to Kerry. Hi, Kerry. And Kerry says, my question's for Tracey. In your consultations around free birth, are you including individuals who have chosen to free birth, as well as traditional birth attendants who are hard to reach and engage with? But I think it's an important aspect of this. I think it's individuals who've chosen to free birth, as well as traditional birth attendants. I'm not sure. You might actually, sorry, Kerry, you might need to clarify traditional birth attendants, because this feels like a more international term.
Yes.
We would use midwife. So maybe if you can clarify that and come back. Sorry, Tracey,
Okay.
I hadn't written the whole question. Okay, we'll try Claire Bunyan. Hi, Claire. And Claire says, will SSA be reviewed? Whilst there are some good things about it, in my experience, some practice supervisors do not have the same buy-in to the students' experience and learning as the old mentorship system. I'm not sure if that's a Jacqui question. The SSA?
Yeah, it can be. I think we definitely know that there are probably areas within the SSA we want to strengthen, and that's been based on the experiences that the students are telling us about, and the practice assessors and supervisors are telling us about. This is not a rewrite of the standards. I have to sort of stress that, because that is a huge piece of work. But I think looking at various standards which align to what we found in that part one piece of work with Nuffield is important. And I think, we were talking about this yesterday, weren't we, Tracey, that we still recognise there's still quite a lot of work to do around implementation and adoption, and we of the standards, even though they've been around a few years now. So I think, within our wider work that we do out with this learning review, I think we need to sort of think about maybe some slightly different approaches to build on what we've been doing already.
Okay, more work in progress. Crikey. Okay, I've got Talia Uyenemen. Sorry, Talia, if I've pronounced that badly. From Liverpool. Can the email for community engagement be posted, please? I think that might be one for Paul, if Paul can post the community engagement. Sorry, Jacqui.
Well, you have to sort of if you follow the link in your resources, and then you go down and there's a link, and that's what takes you to the page that you need.
All right, okay. If
Paul can help, that would be great. But I think it'd be useful to get some of the background, because I've sort of précised the key lines of inquiry, and it's a bit more context, I think.
Okay, fabulous. Thank you. Okay, and Sorcha, hi Sorcha, says it's a large focus around SLIC, stroke clip, stroke SLEC model in most maternity units for students. Will this be embedded into midwifery education within the pre-reg programme for the students to learn with other multidisciplinary professionals? I think this is my big one.
Again, we don't ever stipulate certain models, because, of course, models, evolve and develop and change, new ones come along. But I think that's absolutely what the SSA standards did. It enabled different approaches, such as sort of coaching, to be introduced. So I think that's important. But of course, it then comes down in terms of operationalising this at the local level, working with the universities, working with their practice learning colleagues. So, definitely I'm aware of these, much more diverse sort of approaches to learning. And of course, those standards enabled a whole range of multidisciplinary, multi-agency colleagues to actually supervise students, midwives, which wasn't the case in the previous model. So it does mean that students can spend time with all of these other healthcare professionals, such as health visitors, social workers, obstetricians, and etc. Without sort of, they won't spend all that time because they've got midwifery proficiencies. But the SSA enabled that absolutely to happen, to enrich their experience of the multidisciplinary, multi-agency teams.
Okay. We're moving on. We've got Yuwande Oluwasi. Says, thank you very much for the lecture. I'm an internationally registered midwife and recently got my PIN in January. Well done. Fabulous.
Well done. Great.
I'm yet to get a job, but I will like to know how to stay updated as an NMC registered midwife. Maybe I ought to throw that one to Tracey.
I think as part of revalidation, you do need to keep up to date and have the CPD. So I would say take all the opportunities you can get to go to courses, go to festivals, go to different things, and make sure that you get your reflections so that you have something to keep you up to date. So the 3 years between sort of registering and revalidating are your opportunity to think about what you want your career to look like, how you want to shape it, and make sure that you focus your CPD, your continuous professional development, around the scope of practice that you want to achieve. So be intentional in what you're looking for and look for things that can keep you up to date. There are things such as sort of volunteering, shadowing that you can do so that you are keeping within the midwifery world. And that's what I would suggest you do.
Fabulous. Thank you, Tracey. I mean, I have to say the NMC has got a fantastic revalidation resource, which is really useful if you want to just check. Because I know sometimes people get to the revalidation date and think, oh, I've got to get all my certificates, I've got to do all these things. But actually, if you do it proactively and start looking at it now, and this is very good that you're thinking about it. If you look at the NMC resource, just look at now, it's www.nmc.org.uk, isn't it? And you just go and look for midwifery and there's a whole revalidation site, unless it's altered since I last looked at it. But
points just to add, Sue, I think with the revalidation, that's quite important because obviously there is an hours requirement.
Yes.
So hopefully the inquirers being, being hopefully going to get some posts and I think if they get into difficulties, there's lots of other people who can maybe help to secure that employment, like the regional chief midwifery officers, etc. That if they want to get back in touch with us, we can help them. And I think the other thing, if they want to particularly keep in touch with the NMC, is we have a newsletter for midwives that you can sign up to as well. And that's a quarterly.
Do you know, I'd forgotten that, Jacqui. Thank you for that. Fantastic. So, Yuwande, welcome to the midwifery life in the UK, and I hope you find a job very soon. Welcome. And then we've got Kerry, who's come back to clarify. I'm not sure if it's completely clarified for me, Kerry, but Kerry says, I have met traditional birth attendants in England, which is my area of practice. It was a question around stakeholder engagement, which was talked about when you mentioned doulas, for example. So I'm not sure if traditional birth attendants would be a term we would use in the UK or England as a person because of the well, I'm going to hand over to Tracey, who should probably say protected title, I would suspect.
So yes, we use the protected title. So that's why the term that we have used in this piece of work, we started by saying it was around unregulated people because that's what it's about. So whether it's a birth attendant, whether it's a doula, whether it's somebody with registration that's no longer on the register but that was a midwife, they're all unregistered. And so it will be that they're unregulated from our perspective, and that's what this piece of work has been about. So not just doulas, but I think I said Doula UK because they were one of the stakeholders that were involved, but we have communicated with loads of different stakeholders and loads of different people to get to the point that we're at.
Fabulous. But Tracey, there's presumably a nice chunk of information on the NMC website on the
There
work.
will
There
be
will
when
be.
the work completed in the spring, but we're just at the final stages. But we are working towards getting everything on the website shortly.
I'm just amazed about what you guys do, I have to say. It's fantastic. I think we've now, I always say this hour is the fastest hour in the week, and it's come to an end. Now, for the audience, thank you so much for the questions that come through. And if you didn't manage to get the question in, you can always email and get a question in. But also, I'll be very happy if Tracey and Jacqui were able to come back at some point, maybe next season. And certainly, mostly Jacqui and Verena come to the festivals. So come to a festival and address personally. It's even better to have a chat, informally, whatever. So I want to say a big thank you to Tracey and Jacqui for joining us and getting us thinking about the complexity of all of this, the proficiencies and the whole learning and practice learning that's going to be coming up, and get into that. Now you're going to say community of interest. Yes. Have I got it right, Jacqui?
Yes.
Yes. It's all the words now at the end of the day. And also I want to say a big thank you to Angela, who's making sure it's all being recorded so you can access this afterwards. And you might want to share it with colleagues at work in a quiet moment, if that ever happens. And if you're a student, maybe share it with colleagues at university. We like you to share, and that'd be fantastic, because I think the more people know about what's happening is the more we can get involved and have your say, and also know what's happening. It's really important. So resources, this is going to be available as a podcast on 6 o'clock on Friday morning, and also it'll be available on Tuesday with the newsletter. If you haven't signed in for the Maternity and Midwifery newsletter, get signed in, because that means you get the newsletter, you get these fantastic little articles that come through, which are perfect because they're not too long, not too wordy, but they give you something to think about. And also you get the links to the maternity hour sessions. Now, next week, funnily enough, we're going to be looking at advanced midwifery practice with Romy Luxton and Sinead O'Kane. So that's another thing to think about, because that's kind of further down the line as well. And that's another piece of work that's going on with the NMC. It's fantastic. Also, don't forget to book, there's an infection control seminar, 25th of March, 1 till 2, with Dr. Rachel Maguire and Professor Dinah Gould, I should say. It's online, really would be very interesting. And then there's the Midlands Festival on the 20th of May that you can sign up. So in the meantime, thank you so much for being with us. We'll see you same time, same place next week. And in the meantime, stay well and take care of yourselves. See you later.